Assalamualaikum and hi everyone. Today we will explore white dot syndromes. These are our group members. Next are the topic for our presentation. White dot syndromes are a group of rare inflammatory disorders affecting the retina and choroid. They are named after the characteristic white lesions they produce in the retina or choroid. These conditions are rare and their exact causes are often unknown. Commonly presenting symptoms include photopsias, blood visions, floaters, and visual field loss. We will discuss their key features focusing on three main types, which are multiple evanescent white dot syndrome (MEWDS), acute posterior multifocal placoid pigment epitheliopathy (APM-PPE), and birdshot chorioretinopathy (BCR). Let's begin with the first type. MEWDS typically affect young adults, more commonly women, and usually unilateral, meaning it affects only one eye. Many patients report a flu-like illness before their eye symptoms start. The main symptoms include blood visions, photopsia or flashes of light, dyschromatopsia, and scotomas, which are areas of visual loss. The white dots are seen in the outer retina and retinal pigment epithelium, mainly around the macula and extending to the mid-periphery. Next is APM-PPE, an acute inflammatory disease that commonly affects young adults in their 20s and 30s. It is usually bilateral, meaning it involves both eyes, although one eye may be affected first. It's often preceded by a viral illness. The characteristic lesions are creamy, placoid spots located in the posterior pole. These lesions evolve and resolve over 2 to 3 months, leaving behind areas of hypopigmentation. The symptoms include sudden painless vision loss and scotomas. Finally, we have PCR, which typically affects middle-aged adults between 40 and 60 years old, and there is a slight female predominance. Early symptoms include blood vision, floaters, and photopsia. Later symptoms include night and color blindness. The creamy white lesions are oval or round and clustered near the optic disc. The exact causative agents of WDS are mostly unknown, but there are some theories that suggest potential triggers or underlying factors. For MEWDS and APM-PPE, the exact etiology are unknown, but it is associated with a preceding viral or flu-like illness and a viral infection or systemic infection like influenza. Lastly, BCR is strongly associated with the HLA-A29 antigen.
Next, we have the mechanism. The exact etiology remain largely unknown, but several mechanisms have been proposed based on clinical observation and imaging studies. First, we have autoimmune or inflammatory response. Many researchers believe that white dot syndrome arises from autoimmune processes. This means the immune system mistakenly attacks retina cells. Key players in this process are activation of antigen-presenting cells or APC, such as dendritic cells, which interact with T cells to induce the release of pro-inflammatory cytokines. This inflammatory response attracts immune cells, including lymphocytes and macrophages, leading to the formation of the granuloma in the retina. Next is a genetic factor that also contributes in the development of white dot syndrome. One of the most compelling pieces of evidence is the association of specific HLA antigens. For example, HLA-A29 is strongly linked to the birdshot chorioretinopathy, one of the white dot syndrome. Beyond HLA antigens, studies suggest that certain genetic loci associated with other autoimmune diseases may also contribute to white dot syndrome susceptibility. And another one is infectious agent, particularly viruses in triggering white dot syndrome. Certain viral infection is thought to activate the immune system and can invade the retina, spreading between photoreceptor and causing cellular damage. This process may trigger an inflammatory response that leads to the characteristic white dots. Tests commonly used to identify white dot syndrome. First, we have fluorescence angiography. Fluorescence angiography is a crucial imaging modality for visualizing WDS lesions. This test reveals early spot hyperfluorescence in a wreath-like pattern and late staining corresponding to the white dots. It also helps differentiate between various types of WDS. Second, endocyanic green angiography. It evaluates choroidal vasculature more effectively than FA and useful for detecting deeper lesions in the choroid. ICGA is also useful for diagnosing conditions like birdshot chorioretinopathy. And the third one is optical coherence tomography or OCT. OCT help assess structural changes in the retina and RPE, revealing abnormalities such as photoreceptor damage and thinning of the outer nuclear layer in chronic case. This test is invaluable for monitoring disease progression and treatment response. Next, we have fundus autofluorescence. Fundus autofluorescence detects hyperautofluorescence lesions that correlate with white dots. This technique is particularly sensitive for diagnosing certain forms of WDS, even when lesions are clinically invisible. And for the visual field testing, it is useful for measuring the level of visual impairment and tests for localized vision loss such as an enlarged blind spot or other scotomas can be confirmed. And the last one is laboratory tests. Laboratory tests, while generally having low diagnostic yield, it can be relevant in specific case. For example, HLA A29 DNA typing is highly specific for birdshot chorioretinopathy and for HLA-B7 and HLA-B8 for certain subtypes of WDS.
Treatments for the white dot syndrome include number 1, both oral and intravitreal corticosteroid can be prescribed to decrease inflammation and inhibit the immune response. Number 2, immunosuppressive medications such as azathioprine or mycophenolate mofetil that suppress the immune system might be used to manage the inflammatory process. Number 3. In certain cases, biologic agents such as anti-tumor necrosis factor or anti-TNF drugs may be recommended for their immunosuppressive properties. And lastly, number 4, intravitreal injections of antivascular endothelial growth factor or anti-VEGF agents such as ranibizumab or bevacizumab might be employed to treat neovascular complications in specific types of white dot syndromes. While it can be challenging due to its unknown causes, the white dot syndrome can be prevented using the following methods. Number 1, regular eye checkups. Regular visits to an ophthalmologist help catch problems early and ensure prompt treatment, leading to better eye health outcomes. Number 2, healthy lifestyle. Eating a balanced diet rich in antioxidants and omega-3 fatty acids, staying hydrated, and exercising regularly support overall eye health. Number 3. Manage health conditions. Working closely with your healthcare provider to manage autoimmune diseases or diabetes can help reduce the risk of eye-related complications. And finally, number 4. Eye protection and UV protection. Using safety goggles during hazardous activities and wearing UV protective sunglasses outdoors help prevent eye injuries and damage from sunlight.
These are our references. That's all. Thank you.